COVID manifests uniquely in each individual, and for those with comorbid conditions, the effect of the infection most turns severe. Especially people suffering from diabetes when contracted by COVID-19 infection witness adverse symptoms. While in the first wave, the elderly with conditions like diabetes, cardiac problems were most affected by the pandemic. In the second wave, however, even younger generation with lifestyle disorders have been hit badly by the infection. Uncontrolled diabetes not only increases the severity of the COVID-19 when contracted, but it can also make people susceptible to other bacterial and fungal infection as well, said Dr. Radhika V. Kumar, Senior Consultant in Endocrinology, Columbia Asia Hospital, Sarajpur Road, a unit of Manipal Hospitals. Diabetes lowers the immune response, thus making it harder for the body to fight the virus. Therefore, COVID-19 infections combined with diabetes can affect the overall well-being of the body, causing severe health issues, thereby prolonging the recovery time. Also, diabetes can increase blood sugar levels, and studies have proven that viruses like COVID can thrive in the high blood sugar environment. Uncontrolled diabetes can also hamper the blood flow, making it difficult for the body to harness nutrients, which is a natural defense system. Therefore, diabetic patients take time to recover from the infection. Also, diabetes keeps the body in a state of low-level inflammation, which usually delays healing, Dr. Kumar said. The concern is increase in blood sugar level with the COVID. Let's look at that. The increase in COVID cases and the subsequent lockdown have forced people to stay at home. This has drastically reduced physical activities. The closure of gyms and parks has also added the woes, making people less active. This has had a drastic impact on health as well as the blood sugar level. When the body encounters any kind of infection, it increases the blood sugar level. An unhealthy diet, high fever during the COVID times can increase the sugar level in an individual. The intake of steroids, which is unavoidable in a few patients as a part of the medication, can add to it. Therefore, it is mandatory to get the blood sugar level tested on a regular basis and take precautions to control high blood sugar levels. If the patient is diabetic and has tested positive for COVID, it is important to monitor his blood sugar levels and if required, needs to be treated with insulin, the expert explained. In addition to diabetes during COVID, it can also cause complications like the diabetic ketoacidosis. Uncontrolled diabetes combined with COVID-19 can put a person at risk of developing diabetic ketoacidosis. This occurs when high level of acids called ketones build up in your blood. This condition can lead to a medical emergency. Another one is mucormycosis, which is uncontrolled diabetes coupled with COVID-19 may lead to mucormycosis in fewer patients. High sugar level, steroid usage along with COVID infection can further add to the risk. Another one is pneumonia. People with diabetes who develop COVID-19 also have higher risk of developing a more severe form of COVID-19 like a pneumonia.